Hello, and welcome to our program. We're here with Dr. Harold J. Schock, an orthopedic surgeon with Orthopedics and Sports Medicine BayCare Clinic. He's board certified by the American Board of Orthopedic Surgery in both general orthopedics and in sports medicine. We're also joined by Alyssa Schultz, a physician assistant, also with Orthopedics and Sports Medicine BayCare Clinic. Today we're hosting a Q&A type session focused on shoulder conditions. We'll learn about rotator cuff conditions and treatment options. Before we get started, we want to invite you, our viewers, to feel free to ask your shoulder-related questions in the comments section. We'll do our best to answer your questions in real time. If we don't get your questions in real time, however, don't fret. We'll answer them at the conclusion of this live stream. So thank you again for joining us. Thank you for joining us, Dr. Schock and Alyssa. We're talking today about shoulder conditions. Dr. Schock, we use our shoulders for a lot of actions that many of us take for granted. Reaching, pulling, lifting, they all require healthy shoulder function. When these joints are working properly, day-to-day tasks like getting dressed, combing or brushing our hair, taking a shower become increasingly difficult. But that's where you come in. Dr. Schock, let's talk a little bit about rotator cuff conditions. We have an image that we'll kind of put up to kind of guide the conversation. First off, what's the function of the rotator cuff?
Yeah, Femi, thanks for having us. And as you alluded to, really the basis of shoulder function is the rotator cuff. The rotator cuff is comprised of four separate muscles. They're named the supraspinatus, infraspinatus, teres minor you see on the back on the lower diagram, and then the subscapularis is a muscle that comes across the front of the shoulder, and the biceps tendon sits within that subscapularis. So those are our primary four rotator cuff muscles. And again, they really are the basis for shoulder function. And really when we see almost any type of shoulder injury, there's some component of rotator cuff anatomy and mechanics that are important to help solve those patients' issues.
Okay. Well, what about the labrum? I hear about this part of the shoulder as well. What's the function of the labrum?
Yeah, the labrum is really an interesting structure, and as the diagram nicely depicts here, that biceps tendon goes up, and this is labeled the long head of the biceps tendon, goes up and attaches to what's called the superior labrum. And the labrum is actually, if you think about the socket of the shoulder as a plate, that ball sits in the plate, and what happens is there's a ring of tissue around that plate or around that socket that acts to deepen the shoulder socket and helps give the shoulder relative stability. And if you look at just the shape of the bony anatomy of the shoulder, that ball would fall right out of the socket if it wasn't for all the soft tissues, including the labrum, that are important for the constraint around it.
Right. Well, good to know. Let's get into some of the nitty-gritty then. What are symptoms indicating that there's an issue with the rotator cuff?
Yeah, that's a good question. And it can really be a whole variety of symptoms. And we have patients that we see rotator cuff injuries from sometimes we'll see young athletes that have a shoulder dislocation that result in a rotator cuff injury. Sometimes we'll see laborers who do repetitive type work where they do a lot of lifting above shoulder height over a repetitive period of time that can kind of slowly develop a rotator cuff injury. Or even one particular episode, you may slip and fall on the ice, try to catch yourself on an outstretched arm. That's another common mechanism we see of rotator cuff injuries. Then also sometimes we see people that just have kind of attritional wear over time. Or, some of our people who are in their 60s and 70s that have years of wear and tear that may not have any particular injury that they recall, but have developed a rotator cuff tear over time.
Okay. And what is a labral tear or a slap tear? Can you define that for us?
Yeah, a labral tear or a slap tear, again, sort of goes hand in hand with the rotator cuff injuries. And the way people present them, you can have all kinds of, pain sleeping at night, you have difficulty reaching over your head, again, with repetitive movements. And what a slap tear is, it refers to that second diagram that we saw where that bicep tendon attaches to the superior labrum.
Sure.
Oftentimes when we have an injury to that rotator cuff tendon, we'll also have an injury to that superior labrum, and specifically that subscapularis, or the rotator cuff muscle in the front of the shoulder, kind of envelops or goes around that biceps tendon. And oftentimes those injuries will go hand in hand.
So then, kind of keeping with the theme, how do you diagnose shoulder injuries, especially to the rotator cuff?
Yeah, the diagnosis and kind of sorting out what exactly it is that's causing an individual's shoulder pain or dysfunction is actually a really fun part of my job, because there's a lot of different sort of parts to it. I think the first and most important thing is taking a patient history, see what types of activities are aggravating for them, what types of activities may make it better. You also want to see, was this something that came on acutely? Was it all of a sudden a slip and fall on the ice, or is this something that has been developing over years? And you look at the patient's motion, and is the motion good? Is the motion not good? And that may lead us down one pathway or another. And also, what type of treatments or interventions has the patient done already?
So in all the shoulder injuries or just malfunctions that you've treated over the years, what have you found to be maybe the similar culprit in all these cases? Is there one thing that, generally speaking, you can point a finger to and say, well, that's why you have this issue?
Yeah, I think in general, rotator cuff injuries tend to be sort of multifactorial, so there can be a number of different things that can contribute to them. And I would also say that, and I always talk to patients about this on a daily basis, not all rotator cuff injuries are exactly the same. And
Sure.
The rotator cuff injury in one individual may be something that they have lived with for a long period of time and don't have any issues with, where almost the exact same finding on an MRI of a rotator cuff on another individual may be debilitating, and they may have difficulty getting through their normal day activities with that.
Are rotator cuff issues just an inevitable part of the aging process?
Yeah, that's a good question. That's something we hear a lot in the office, and I guess I would say that if there are certain anatomic factors, bone spurs, things like that, as well as activities, both work-related and sporting, that may contribute to rotator cuff issues. And there are certainly things that we can do from a therapy standpoint to try to prevent rotator cuff issues. But certainly as we age, we are much more likely to have problems with our rotator cuff tendon.
Okay. And we talked a little bit about the labrum earlier. So let's talk about labral issues. What happens when a labrum goes awry and a patient finds himself or herself sitting in front of you discussing that shoulder issue?
Yeah,
what's going on there?
Sure. Oftentimes, in discussion of labral-based issues, and sometimes patient demographics come into play. A lot of times, our labral-based issues we'll see in our young contact athletes. As we have younger people that have either shoulder subluxations or potentially dislocations, we're often talking more specifically about labral-based issues. As we get into our mid and upper 40s, oftentimes those very similar injuries may result in both labral as well as rotator cuff-based issues. There's some change in the composition of the rotator cuff tendon as we age that makes those things sort of go hand in hand as we age. And then when we're getting into our 60 and 70-year-old patients, often almost invariably we're talking about a combination of both rotator cuff as well as labral-based issues.
Okay. All right. So in general, when should we actually find ourselves in front of a doctor when we have suspected shoulder issues?
Yeah, that's a question that I'm asked on almost a weekly basis, whether it's by friends, family, or patients in the office who say, gosh, I'm not sure I really should have come in for this. And I think there are a couple general rules. I mean, if something has happened where you've had a sudden change in the function of your shoulder, for example, if you're able to lift your shoulder to the high in the cabinet last week, and then all of a sudden something's happened, now you can't lift the shoulder above your chest height, then I think that's a reason you get to see a doctor sooner rather than later. I think that if you have shoulder pain that's waking up at night from sleep, or modifying your activities significantly for a period of 2 weeks or longer, I think that's a good reason to get to see a doctor. I also think if you've had some traumatic injury and you have a lot of pain in the shoulder that just doesn't seem to be getting better, or if it seems as if it's getting worse on a daily basis, another really good reason to get in and seek care.
Okay. All right. Well, if we don't seek care in a timely manner, what are some issues that we might be facing down the line?
Yeah, as we alluded to a little bit earlier, one of the interesting things about the shoulder is that it's so reliant on the soft tissues around it for proper function. And if we delay treatment, one of the very common things that we see in the shoulder is we'll lose motion. And there's a capsule that surrounds the shoulder joint that tends to get very tight. So if you delay treatment for shoulder conditions, it's not unusual, and we'll see people every year who have delayed treatment for one reason or the other, and whatever the initial injury was now becomes a bigger issue because now they get what's called a frozen shoulder, where that capsule gets very stiff around it.
Okay, great. Thank you so much. Thank you. Such informative conversations here. Alyssa, let's get you involved here. Let's talk a little bit about how common rotator cuff conditions are. How often are you seeing and treating patients with rotator cuff issues, or frankly, other shoulder issues?
Rotator cuff issues and other shoulder issues are probably the second most common injury or issue that we see. With sports medicine, we do see a variety of things, but ultimately, like I said, it's probably the second most common. Seen over the years, probably thousands of shoulder issues and shoulder injuries, though.
Great, great. Then when a shoulder condition is diagnosed, how do you determine the best treatment option?
Well, as Dr. Schock said before, we take a very good history. We also do a very thorough physical examination and do some x-rays. And at that time, we kind of determine, do we need to do further imaging? Can we stay on the conservative path at that time? But a lot of times depending on what the exam findings are, we may be talking about doing an MRI scan or sometimes an ultrasound to determine what exactly is going on inside the shoulder joint.
Do you find that people can sort of self-manage and improve their own rotator cuff issues?
If we know for sure that they don't have massive rotator cuff tear, it's reasonable to, try a week or two of treatment at home, some anti-inflammatories, stretching, range of motion stuff, but you can't truly know that without a physical examination and possibly imaging. I mean, if you ignore possibly large rotator cuff tear or something like that, you can lead yourself to further problems down the road with regards to less predictability of surgery, maybe some arthritis down the road. So ultimately, if a shoulder issue is limiting your life and you're not able to do the things you want to do, you should ultimately seek treatment for it.
Okay. Is it safe to say that just because I have shoulder pain or maybe some kind of mobility issues, it isn't always just a rush to surgery?
Yeah, absolutely not. I would say there's a very large percentage of our patients who don't end up having surgery. I mean, a shoulder surgery is a very lengthy recovery.
Sure.
So we try to avoid it if at all cost. But there's a lot of times that we put patients on a conservative path between exercising, injection, strengthening, definitely range of motion things. And a lot of times patients get better with a good conservative plan, and we try to stick to that whenever possible.
Okay, and that actually leads us right into a question I see we have from Deb, and she's asking, if you have a rotator cuff tear, will PT help in any way?
Rotator cuff tear, it depends on how big the tear is. I mean, if you have a partial thickness rotator cuff tear and the rest of it is intact, physical therapy can definitely help that. If you have a full thickness rotator cuff tear, physical therapy can help with motion and get the shoulder moving, but unless the tendon is actually repaired back down to the bone, it's not going to heal itself. It's the function of that rotator cuff is to hold that ball into the socket and that tendon is always being pulled further away. So if we ignore that, that tendon's going to keep pulling further away and the tear may get bigger.
Okay. Well, thank you both for your expertise. Now I've got a series of questions for Dr. Schock. Alyssa, we'll catch up with you in a little bit.
Thank you.
Dr. Schock, and we've got another slide here. Great. Let's talk rotator cuffs in a bit more detail. What are some non-surgical treatment options for rotator cuff conditions?
Yeah, it's actually, I think that last question is a good segue into this, and really, physical therapy is a huge part of the treatment of either a surgical or a non-surgical rotator cuff injury. And to echo what Alyssa said, the majority of our shoulder conditions are treated non-operatively. And the really kind of some of the conservative treatments for rotator cuff tears, sometimes we'll think about injections. Again, we've hit physical therapy, anti-inflammatories. I would tell you one thing that I've learned from my patients is that swimming or there are several other sort of upper body type activities which are very helpful for people with rotator cuff injuries.
Sounds like low impact activities?
Yeah, especially low impact, focus on motion.
Okay. Well, then what are some surgical treatment options when you encounter a diagnosed rotator cuff condition?
Yeah. From a surgical standpoint, it really depends on age, activity level, the type of tear. Again, something I try to reinforce for my patients is that every rotator cuff tear is not equal, and there's a lot of factors that sort of change. With regards to surgery, sometimes we'll do it's something as simple as just to debride a small portion of the tear. Often we're putting in an anchor like you see in the picture depicted here to the side. Sometimes one anchor, two anchors, up to four anchors. Sometimes or even 5 or 6, sometimes a repair, depending on what the rotator cuff tear looks like. And then kind of on the end stage, if there's a rotator cuff that isn't repairable, there are some other options. There's some augmentation that can be done. Sometimes folks are candidates for actually a very specific type of shoulder replacement if the rotator cuff isn't functioning. But again, those are sort of few and far between. So again, it really depends on, each rotator cuff tear is a little bit different.
Okay, good stuff. What do you need a patient to do to prepare for rotator cuff surgery?
I think there are a couple of really key features, and having watched thousands of patients kind of go through the process, well, what we see is that if patients are appropriately educated and appropriately kind of prepared for surgery on the front end, often they do better and there are fewer surprises. And I'll also tell you that I think that we're doing a lot better job controlling pain around the time of surgery.
Sure.
So the sort of preoperative education is a huge piece of what patients can do to prepare. Then the other piece, oftentimes we do some physical therapy, or what we refer to as prehab, to try to get the muscle around the shoulder in the best shape possible to really set them up for the optimal rehabilitation after surgery.
Okay, good, great information. I love it. Let's talk a little bit about what patients can expect during an actual rotator cuff procedure. Talk a little bit about that. We have some supporting video that'll help kind of help us along the conversation. So what are we seeing here?
Yeah, so this is actually an example of kind of a small-ish rotator cuff tear. You see there's nice mobility. That's an arthroscopic instrument that we're using to bring that rotator cuff tendon over. And you'll see with that tear, that hole right there, this is really kind of we're grasping, and the goal of this repair is to bring that tendon over to that area that we're pulling it to.
Right.
And that bone that you see below there, we're going to put an anchor into that area. You'll see that shortly, I believe, and pass some stitches through and kind of tie that all down.
Right. Let's look at that anchor.
So that's an anchor. There's the technology in what we do is very, very interesting. That's actually what's called peak anchor, and that's a material that is going to be incorporated in the bone. You see the little holes as it goes in. The bone's actually going to ingrow into that anchor, and those stitches are very, very strong, and they're small, about the size of dental floss, but those stitches are able to hold hundreds and hundreds of pounds of force. And basically we put that anchor in the bone, we use those stitches to pass through the rotator cuff tendon, and then we'll tie it all down.
Right. Then let's talk about the suture pass.
So you'll see this is an example of a suture passage device. So basically we put that anchor in the bone, we're passing the stitches into the tendon, and this is a real-time video of tying the knots down. You'll see that there's a little bit different. You see two different arthroscopic instruments in this clip. We're pushing that knot down to secure it, and we'll repeat this process 3 times during this clip. And a lot of the majority of the anchors that we have these days are what we call triple loaded. So we do kind of 3 suture passages with each anchor.
Okay. And then the next step in this process?
In this particular case, we've taken the stitches, passed them through the tendon, tied them down. Now, in this case, we're putting a lateral row anchor down. You see the stitches that have been attached, tied through the rotator cuff. And now we have another really strong anchor. And this is going to, again, be an anchor. You see the holes in it. The bone's going to incorporate through the holes. And this particular anchor actually, over time, will become bone. Will actually incorporate right into the bone.
Wow. And our final clip is actually of the repaired rotator cuff.
Yeah, in this clip, we see that this is the finished product. That's that tendon being compressed down to the bone. And you see when we move it back and forth, it all moves as a unit. And you can see that nice motion is a unit there. And if that tendon heals there, I feel very good that patient's going to have the results that we came to the operating room for.
That's amazing that we can get footage like that. I'm in awe. But okay, great. So do you feel that during the pandemic, it's actually still safe to have an outpatient surgical procedure?
Yeah, I think that's a great question. That's something that we're facing on a daily basis, and I feel that question a number of times. And really, I think one of the key components is that, at this point, early on in the pandemic, maybe we didn't really know. A year ago, 9 months ago, it was kind of uncertain. But I think at this point now, we've seen thousands and thousands of outpatient procedures done very safely. And the other thing is, when particularly the surgery center that we're at, I tell my patients now that everybody that you meet that works there has been vaccinated twice and essentially, to the best of our knowledge, immune to COVID. And every patient that's in there is tested. So in terms of safe places to be in Green Bay around other people, I don't know of any that are more safe than that.
Right. Good stuff. So we saw some of the surgical footage. Then what's involved in recovery then?
Yeah, it's good. So the recovery the surgical footage and the surgery is really only it's a very important part of the piece of the puzzle. I always tell my patients that 50% of a good result is the work we do in the operating room, and the other 50% is the work that they and the therapist do on the back end.
Right.
And it's incredibly important on the back end that the therapist, the surgeon, the patient, all are working together as a team. We may need to modify protocols as we go. And the therapy on the back end for at least 6 weeks up to 3.5 months sometimes is critically important for a good result.
So is therapy a must after a procedure like that, or is that just for certain patients?
Yeah, the vast majority of our patients do undergo formal physical therapy after a procedure like this. There are a few select cases where we don't do that. There's some home exercise programs, but the majority of our patients do undergo physical therapy. And I think the majority of our patients at the end of the process really say that physical therapy was a critical component for them.
Okay. Well, I'm glad you said that, because my follow-up question is on the importance of completing therapy. I'm guessing not everybody follows the doctor's orders. So talk a little bit about that.
Yeah, it's true. And again, I wouldn't say that when we look at the specific rehab program that we're using, it's not really a one-size-fits-all scenario. Right. Again, every rotator cuff tear is a little bit different. The rehab associated or the rehab necessary is also different. The function and people's expectations for results are also different. So I think that every individual kind of has a tailored program on the back end of this, of a surgical repair like this. And everybody's rehab's a little bit different, and goals and expectations for what they want to get back to are different as well.
Okay. Excellent information. Thank you so much. Thanks for joining us. And if you are just joining us, we're here with Dr. Harold J. Schock, an orthopedic surgeon with Orthopedics and Sports Medicine BayCare Clinic. He is board certified by the American Board of Orthopedic Surgery, General Orthopedics, and Sports Medicine. We also are joined by Alyssa Schultz, a physician assistant, also with Orthopedics and Sports Medicine BayCare Clinic. We're here today discussing shoulder conditions, specifically rotator cuff issues, and recommended treatment options. Alyssa, welcome back. So we're going to discuss a little bit with you, and we're going to say bye to Dr. Schock for a little bit. We'll see you very soon. Wanted to discuss with you the importance of taking action when something just doesn't feel right in the shoulder. There are many of us that would just kind of grin and bear it and keep on moving, pop in a leave, pop a Tylenol, whatever. And even though we're feeling this pain and this discomfort and this affected mobility, why is that a bad idea?
Sometimes by ignoring things, we can actually make them worse. Two probably of the big things that you have to not ignore would be, I think Dr. Schock had talked about it before, would be range of motion. So if you're losing range of motion, you used to be able to lift your arm up over your head, and now you can't lift it above shoulder height. If you're ignoring something like that, you can actually start developing something called a frozen shoulder, which is extremely painful. And if we can stop the process before it gets too bad, you're in a better spot. The other thing that we want you not to ignore would be weakness, especially overhead. So again, being able to lift something overhead, even just something as simply as getting a plate out of the cupboard, used to be able to do it and now you can't. If you're ignoring weakness, you might be ignoring a pretty large rotator cuff tear. And if you ignore a large tear, that tear can get even larger and may turn into something that might not be repairable when you're finally ready to do it.
So help me again, just to understand, how do I know that I've reached the level of severity where I need to actually speak to a specialist about my shoulder issues?
Well, we want to make sure that your shoulder is not causing you to miss out on life. Are you losing sleep? Are you avoiding the things you like to do? Are you not gardening? Are you not, people are asking you to do something and you're saying no because your shoulder bothers you. You shouldn't be missing out on life because you have a sore joint. So that's something that's really important to try and pay attention to, along with, like I said, the range of motion and the strength.
Sure. So what is your advice when it comes to any shoulder health related issues like pain, stiffness, limited motor function, so on and so forth? What advice do you have?
Maintaining range of motion, making sure, can you still wash your hair? Can you lean your arm up against a wall and stretch? Overall, trying to prevent yourself from injury. Sometimes that slip on the ice, obviously you can't prevent that. But if you're doing something and you've got a project you're doing in the garage, if you're climbing up on a ladder, maybe climb down the ladder, move it over a couple of feet, and then climb back up again, but instead of putting yourself in an awkward position, trying to avoid those unsafe things that may take you a minute to avoid would prevent you from potentially having an injury down the road. Right.
Well, what are some risk factors for rotator cuff issues?
As Dr. Schock had mentioned before, subacromial spur, or a spur underneath that acromion bone. When you lift that arm up overhead, that spur can pinch onto that rotator cuff. Repetitive overhead jobs, repetitive use of the shoulder, accidents, but ultimately having good form. Even someone who does computer work, sitting at your desk, having your desk appropriately set up. Have your computer monitor at a good height, your mouse, your keyboard, everything appropriately set is going to prevent you from having shoulder injuries.
Okay. You actually answered my last question there. And that was offering tips on how best to ensure your shoulder health. So
I think a couple other things might be, overall healthy lifestyle. I mean, smoking can decrease tendon health. So something like that. So trying to be as healthy as possible, eating healthy, but again, avoiding those repetitive things and just trying to do smart things, trying to put yourself in smart, safe situations.
Right. Excellent. Let's welcome back Dr. Schock real quick. Welcome back. All right. Dr. Schock, you're a board-certified orthopedic surgeon, certified by the American Board of Orthopedic Surgery in general orthopedics and sports medicine. That's just a lofty achievement there. You're also fellowship trained in sports medicine. Essentially, you've had an awful lot of training. What does that mean for the care that you provide your patients?
Yeah, I mean, I think it's important, and anytime that you're seeking out care for any type of injury, I really think that you want to see the folks that have the best training and the most experience in taking care of these conditions. And I do think that, I've been very fortunate to have some excellent training, and I feel good about the level of care I'm able to provide for patients, specifically with shoulder conditions.
Something that maybe not a lot of people know about you, but they're about to find out. You're a former Division I athlete, and you even played professional hockey, right? So what insight does that give you when it comes to treating your patients for their ortho and sports medicine needs?
Yeah, no, well, thanks for bringing that up. I mean, yeah, no, I've been very fortunate to have a background that has allowed me to have a real wealth and ton of experiences and meet a lot of interesting people, and really with regards to a treating physician, I mean, I've seen, especially with our athletic injuries, I mean, I've seen these injuries from a player standpoint. I actually had a shoulder injury myself that I missed a fair amount of time with. I've seen it from a coaching, from a parent standpoint, from a player agent standpoint. I mean, I feel like at this point I've sort of seen every angle of these injuries, and I really have a good sense as to how it affects our athletes, and it's important to me to take the best care we can of them.
Right, great. Alyssa, you're a certified physician assistant. How does that make you especially qualified to treat your patients?
Well, as a physician assistant, we're trained in multiple areas and specialties. I think myself personally, my undergraduate training was in athletic training, but at this point, I've been a physician assistant for around 20 years now. So I have some background in neurosurgery, and I've actually been in orthopedics for over 13 years. So I think the wide variety that being a physician assistant allows me to do has helped me with my orthopedic career.
Great. Excellent. Well, thanks for explaining that for us. I believe it gives people more information to better help them sort of decide on a provider when they do have these ortho and sports medicine type health issues. So, all right, here's a question for both or either of you. If patients are dealing with symptoms they think might be related to any of the conditions that we've talked about today, what should be their course of action?
I'll take that one, Alyssa. I think that, patients, we laid out a few sort of general guidelines in terms of timing, and I really think that as a general rule, if you're uncomfortable with anything, I think it's safer to come in and be evaluated, especially when we're talking about shoulder conditions. We talked about some of the things that can happen from a negative standpoint if you've let your shoulder condition go too long, and this certainly is an area of the body where if you let it go, you can take a small problem and you can make it worse.
Right. Okay. Are referrals needed to see either of you?
No, most insurances don't require referrals. There's an occasional one, but most patients know personally that theirs would. When a patient schedules an appointment to see us, usually our staff checks into insurance. If they don't have insurance, they try and make arrangements. So our staff on the phone will help them sort through that. But from an insurance perspective, most of them do not require referral.
Okay. So we've touched on a lot today, talking about rotator cuff issues and shoulder conditions. Was there anything that you wanted to touch on that we just didn't get to, either of you? Or did we cover everything?
I think ultimately, we covered it, but if you're missing out on life and you're sore, you're not able to do the things you want to do, don't put it off. You might be putting off something important. So come on in and get seen. We're accessible. Call, make an appointment. We can help you.
And I would echo that really it's we have so many good treatment options now, and certainly they're not all surgical, and there's a lot of great ways we can take care of your shoulder. And if you have something if you're changing your lifestyle for a shoulder problem, come on in and be seen, because there's a very good chance that there are a lot of things that we can do for you and get you back your life.
Great. Well, thank you so much, Dr. Schock. Alyssa, thanks for your time today and for sharing your expertise.
Thank you for having us.
Yeah, and thank you all for joining us. If you have additional questions for Dr. Schock or Alyssa, please ask them in the comments section below. We'll continue to answer them online, so don't fret about that. Again, Dr. Harold J. Schock is an orthopedic surgeon with Orthopedics and Sports Medicine BayCare Clinic. Alyssa Schultz is a physician assistant, also with Orthopedics and Sports Medicine BayCare Clinic. To learn more or to request an appointment, please visit baycare.net. Other than that, thank you and enjoy the rest of your day.